Hi, Taylor here from Capital Physical Therapy. I'm here to talk about postpartum physical therapy. Did this as a live webinar yesterday, ended up with some technical difficulties and didn't get to record it, so I'm recording it again now for everybody. So super glad that you're in tune. If you have any questions at the end, do feel free to contact me. My email's at the end of this. But super excited, yay. Okay, so postpartum physical therapy. I like to start off with a brief little anatomy lesson. This is a pelvis, so pelvic physical therapy encompasses anything that has to do with this region: pelvis, abdominal wall, back, hips, everything in between. A lot of important things run through the pelvis, tiny little area, and a lot of big changes go through, especially with pregnancy and labor, postpartum, everything coming back together. So it's important that we as women address all of these things for the future livelihood of ourselves. So, postpartum. Let me get this little screen out of the way. Anyone who has given birth is considered postpartum. There is not a time cap on this. From the moment you have delivered, if you've had a baby at any point in life, you're postpartum. Depending on the individual, doctors typically clear women for exercise at either the 6, 8, or 12 weeks. It kind of depends on what went on with delivery. Everyone's different, so it is important to listen to your doctor's orders and instructions regarding this. Common postpartum issues that we're going to be talking about today include diastasis recti, urinary incontinence, SI joint and low back pain, pain with intercourse, constipation, and pelvic organ prolapse. The body goes through a significant amount of changes, like I said. And like I said, it's a tiny little area within the pelvis, so we need to take care of it. And just simply saying, just do your Kegels and everything will be fine is not the answer. There are other things that need to be done. I read a little fact the other day that said in the first year of a baby's life, they typically have 8 scheduled doctor's appointments, whereas women typically, after they deliver a baby, they have 1 follow-up appointment 6 weeks. If anything else is going on, they might have 1 or 2 more. But at 6 weeks, if they're clear, they don't typically see the doctor again. But this is something that needs to be addressed. There are things that go on in the body that we can work with. So, let's see. Diastasis recti. So what is it? Separation in the abdominal wall. So with pregnancy, as the baby grows, abdominal wall grows, abdominal wall separates to make room for the baby. Right there at the middle of that, oops, sorry, I just tried to point at the picture. Right at midline, there's the separation. We measure it postpartum with finger width separation, typically at the belly button, above the belly button, and below the belly button. 1 to 2 finger width separation is considered normal postpartum, but the closer that we get that to 1 or none, the better. And it is possible to get it down to nothing. Everyone is different. Everyone's body responds differently, so we can't guarantee it. But my goal is typically 1 finger width separation for people. Why does this matter? So imagine a wall. If there is a hole in the wall, everywhere else has to work that much harder to hold the ceiling up. Same thing happens in the body. Diastasis recti is not a hole, it is a separation. Please don't get the wrong idea about that. It is a separation, but it leads to weakness. And so that's how it correlates with that analogy. Weakness in the abdominal wall means back is working harder, pelvic floor is doing more work, hips taking extra forces, everything trying to compensate for that weakness. And so strengthening the abdominal wall within a healthy range and getting it back to a good position where it's no longer separated or minimally separated is going to help address everything else that we're talking about essentially in this PowerPoint. It's never too late to address the abdominal wall. I've worked with women into their 80s and they've gotten their separation down even smaller. So it's not too late. Important things to be mindful of. Your posture really significantly can impact your abdominal wall. The way we stand puts different forces through our hips, our core, our back, everything. And so standing at different ways increases pressure in the abdomen, and we want to minimize that pressure. While we're trying to get it to heal, we don't want to repetitively stress that area. You want to avoid straining. If you ever feel your belly poke out, coning or doming at midline, that means whatever you're doing is too much stress on the body. Crunches are not the solution. There are so many other exercises that are so much better than just doing crunches. And crunches can stress the diastasis, and we want to put minimal stress on it during the healing phase. Let's see. Urinary incontinence. This is the big one. This is what most people think of postpartum. Can't tell you how many times I've heard, oh, I've had a baby, I leak, that's normal. It doesn't have to be the new normal. There are things that we can do to address this. Stress incontinence encompasses urinary incontinence or leakage with coughing, sneezing, laughing, quick movements. Typically people say they ran to go do something and they felt the leakage happen, or sit to stand. Those different movement-based stress-induced incontinence. Abdominal wall weakness and pelvic floor muscle weakness and incoordination are typically the major causes of this. It's not just do your Kegels, because just doing Kegels might not be the reason why you're having, or might not be the fix. There are other things too. Sudden downward pressure of the abdomen, often mixed with incoordination of the pelvic floor muscles, is the big cause of it. Overactive pelvic floor muscles can also contribute to it. I give people a laundry basket analogy in the clinic a lot. So say you're carrying something heavy, like a laundry basket. Someone comes up, throws a huge pile of towels on it, and that's heavy. Your arms give a little bit, but then they recoil. That little give a little bit is often when leakage happens. It's because we're squeezing so much to try to prevent leakage from happening, and then you have that cough, sneeze, laugh, that big downward pressure. The pelvic floor muscles give a little bit, and incontinence happens. Tips to minimize urinary incontinence. We want to avoid clenching the pelvic floor muscles in response to feeling that sneeze coming or feeling that cough coming. That's a hard one. A lot of people don't like hearing that, but relax and breathe. Forward flex postures can worsen it. So a lot of times people who are running or jogging, if they're jogging and they go to start running, you lean forward typically when that happens, and that puts increased pressure on the abdomen and the bladder, which is going to lead to more incontinence. Breathe, relax. When we start going and giving it our all, those pelvic floor muscles clench up, and we need them to stay relaxed so they can move through their natural pattern. Urge incontinence can also develop. Just because you have leakage doesn't mean you have to go to the restroom, and that's a big thing. We want to avoid jik peeing or going just in case. Try to keep it within a 2 to 4 hour range. Stay hydrated. So many people come in and say, I've reduced my water intake dramatically because of the incontinence, and that's not good. We need to stay hydrated. Dehydration is not good on the body. It's not the solution to fixing urinary incontinence. All right. SI joint and back pain. I think these are the most common things that people think of when they think of, oh, I've had a baby and I need to go to physical therapy. Other things can be addressed too, but these are some big ones too. So, back pain. Why is my back hurting after delivery? That abdominal wall muscle weakness, diastasis recti, can be a huge contributing factor. Altered postures through pregnancy. We tend to kind of lean forward and arch our back with our changing center of gravity with pregnancy, and that can continue postpartum and lead to back pain. Nursing postures as well. Late night feedings. If we're tired, we're kind of slouching a little bit more, then that can contribute to upper back pain as well. Hormonal changes associated with pregnancy and breastfeeding can also significantly impact pain, especially that SI joint. Throughout pregnancy, ligaments are just getting lax. Everything in the pelvis is prepping for delivery. Therefore, altered forces, this thing isn't, all the ligaments aren't holding it as tight as it normally likes to be. And so that can also continue with breastfeeding and post-delivery. Eventually, everything does come back together, but it can take some time and can lead to some pain. The pelvis likes stability a lot, and so there are different things that we can do to help strengthen all the muscles to better support it, and other little tips and tricks. Pain with intercourse. Okay, so this one is one, a lot of things can contribute to pain with intercourse. And it is definitely, I'm very passionate about this. This is something that if you are remotely having this, definitely go see a physical therapist for this. Typically, I mean, there's a lot of things that can be contributing factors. It's hard to touch on all those in this little webinar. Different things that it could be: perineal tears with delivery, scar tissue buildup, trigger points in the pelvic floor and coordination. Treatment techniques do vary depending on what's going on, and a clinical assessment can help narrow down the actual cause and contributing factors. But I always like to tell people, don't just take it. There are things that you can do to address this. Constipation. Okay, so this is another one that is easier addressed in the clinic versus a webinar, but we can talk about it here too. There is an increased water need with the body associated with breastfeeding. If we are a little bit more dehydrated than normal, it can lead to constipation. First thing I always tell people, make sure you're getting enough water in during the day. Pelvic floor muscle incoordination, especially after vaginal delivery, can lead to, or it can contribute to constipation as well. The best advice I can give people, use a squatty potty. They are wonderful. I love my squatty potty. That position is the only way all of your pelvic floor muscles truly relax, and it allows for ease of bowel movements. The picture there, the little cartoon shows somebody using one. Anything that's about 6 inches to prop your feet up on off the ground is a great tool. You don't necessarily have to go out and buy one. Find a step stool, anything that gets you feet apart and knees higher than hips. And also baby bathtubs work really well. If you flip them upside down, you can prop your feet up on there. Avoid straining with bowel movements. Stay relaxed. Don't bear down. Straining is not good, and that's not what we need to do. Pelvic organ prolapse. Another one, easier to talk about in the clinic than via webinar, but wanted to hit on it today. Descent of the pelvic organs is called pelvic organ prolapse. It's named based on which organs are descending and is graded on a 0 to 4 scale. Regardless of where you are in prolapse, if you have it, if you don't have it, if you've had a baby, if you've not had a baby, we are all in a do no harm stage. We don't want to make it worse. We don't want to cause it. That being said, straining is one of the worst things you can do. Breathe. Strengthen the abdominal wall. Your pelvic organs are suspended by ligaments from the abdominal wall, so gentle core strengthening helps with prolapse as well. Pelvic floor incoordination can contribute to it, and we need to cut out repetitive straining. Breathe. One of the most important things I can tell you. Okay, so what do you expect with physical therapy? You start off with a PT initial evaluation, just like you were coming in for any other thing going on. Review of systems, medical history. We're going to look at your posture, your range of motion, your strength. Check you for diastasis. I've gone on a lot. Everything I've talked about includes abdominal wall weakness or diastasis. I'm going to check you for it. We want to get that addressed. Internal pelvic floor muscle assessment if warranted and time permissible. Sometimes we do them, sometimes we don't do them. It's not if you come in, you have to have it. We'll talk about it. We'll just cross that road when we get there. And I also want to start you off on exercises, home exercise program, patient education. I talk a lot and I talk fast, as I'm sure you can see. I apologize if I'm talking too fast now. But I have handouts galore. If you come in to the clinic, everything that we talk about, home program, patient education, I have it all written out on things for you. Follow-up appointments. Continue to monitor, progress the exercises, see what we need to add, tweak, modify. I'm going to tell you, most of the time I see people once a week or every other week for a lot of postpartum needs, but everyone's different. The exercise program and everything will be catered to you, and so we talk about those things in the appointment and figure out the best plan for both of us. So with all that being said, I do want to teach you an exercise. The first thing I teach everyone when they come in the door to see me, diaphragm breathing. Why diaphragm breathing? So when you breathe with your diaphragm, let me start over. Diaphragm is a dome-shaped muscle that sits at the base of your ribs. It's our primary breathing muscle. We are born breathing with it. We just get out of the habit of breathing with it. When you breathe with your diaphragm, abdominal wall contracts, pelvic floor contracts. So it's a good strengthening of gentle core strengthener, and it also attends to pelvic floor muscle coordination, which is so important for all these things that we've talked about as well. So when we take an inhale, your abdominal wall is going to rise up, fill up with air. Exhale, abdominal wall contracts, and pelvic floor co-contracts. It's a natural movement pattern within the body. So I typically don't even start people off with Kegels. Let's start off with diaphragm breathing. So let's practice it here. So I want you to take a good deep breath in through your nose. Let the belly fill up with air. Don't let your chest come up. Let it come from the belly. Exhale through your mouth for a count of 6. Everything draws back in. In through the nose and out. Good. So typically I give it 1 to 3 minutes 3 times a day. It's easiest to appreciate you're doing it correctly if you're in the position that the person in that picture is, on your back, knees bent, a good supported position. But you can do it anywhere as long as you make sure that you're not getting taller while you do it. Now I've also mentioned that posture, move my little screen here. Posture also can impact all of these things as well. So let's talk about posture. In this the top picture on this slide, it shows kind of that hanging out in post-pregnancy arch backed position. So we want to make sure our rib cage is level and at a good good level position. We want to equally distribute our weight between our legs. Pick up our toes in standing. You don't want to shift all of your weight forward or all of it way far back. Good in the middle. Sitting posture is also really important. And you want to sit supported, especially when nursing. Don't slouch over. That can aggravate back pain a lot as well. Let's see. In conclusion, so pregnancy and delivery can have significant impacts on the body, as I'm sure you are aware. Physical therapy can address a multitude of these changes, and it is important to take care of yourself in all of this too. So to get started, work on diaphragm breathing, try to maintain a good upright posture, and do let me know if there's absolutely anything I can do to help. Next steps, if interested in physical therapy, we're offering both in-clinic and via telehealth sessions, especially with all the COVID-19 stuff going on. We just want to make sure that you're safe, baby safe, everybody's safe in the process. All of our sessions are always one-on-one, catered to you and your individual needs. You can either make an appointment via our website at capitalptdc.com or by telephone, which is listed on there. And like I said at the beginning, if you have absolutely any questions about any of the stuff that we talked about, or if physical therapy can help with whatever's going on with you, please feel free to send me an email, taylor@capital.pt. That is capital spelled with an O. And thank you so much for tuning in. It was great getting to share all this information with you. Have a great day.